Today topic is about intracellular accumulation. So basically what does it mean by intracellular accumulation? It means that intracellularly there is any defaulty metabolism so that जो हमारे पास end products थे और जो हमारे पास improper proteins थी they are accumulating inside our cells. These products are usually harmless but if further accumulation हो जाएगी then it will lead to varying degree of injury. So here is the mechanism of intracellular accumulation. So basically in this first picture we can identify this is the normal cell structure in which we have nucleus, we have endoplasmic reticulum, we have Golgi apparatus and we have lysosomes or different types of vacuoles, and as we already know that vacuoles contain the products. So basically this is the normal liver cells, and due to happen of abnormal metabolism the liver contain fat vacuoles that is known as steatosis. Here you can see the normal architecture of the cell is destroyed. All lipid cells are accumulating inside the cytoplasm and the remaining organelles are not functioning properly. The second example is the protein mutation. Like if there is defaulty protein or there is some deficiency, like in case of alpha-1 antitrypsin deficiency, there is defect in the protein folding transport and there will be abnormal proteins. Here you can see these are the abnormal proteins. They are accumulating inside the cytoplasm. That will also initiate the cell injury process. Now another example is the lack of enzyme, like in the example of glycogen storage disease. Here we can see there is a complex substrate. So there will be complex substrate. We have to, with the help of different types of enzymes, we have to catabolize it. We have to make it in a soluble product. So in the case of lysosomal storage disease, there is accumulation of endogenous material and it will lead to the or initiation of the cell injury. Now here basically this mechanism, what happened is that ingestion of some molecules like silica or dust particles or carbon particles. Like example is that the coal workers or the workers who work in the coal mines, they are continuously exposure with the carbon, and then carbon will be inhalation of the carbon, and the carbon is taken up by the macrophages and they deposit inside the lymph node, and that processes, and ultimately with the passage of time they may develop a disease known as anthracosis. Okay, so now comes to the reading portion. So inadequate, as I told you, inadequate removal of normal substance secondary to defect in mechanism of packaging and transport, as in fatty changes known as steatosis in the liver, accumulation of abnormal endogenous substance as a result of genetic or acquired defect in the folding packaging. The example is alpha antitrypsin deficiency. Now failure to degrade metabolite due to inherited enzyme deficiency, जिसमें हमारे पास जो था वो substrate जो था वो soluble product में नहीं बन रहा था. टेक example is storage disorder, glycogen storage disorder. And then हमारे पास carbon की, I have told it the example. In many cases, if the overload can be controlled or stopped, accumulation reversible होगी. Obviously हम जो है proceeding agent को अगर हम stop कर देंगे तो reversible injury होगी. But if it's inherited or the accumulation is progressive and overload, तो cell injury increase हो जाएगी, leading in some instance to death of the tissue and the patient also. ठीक है. Now comes to the major intracellular accumulation molecule, that is lipid. So basically lipid, all major classes of lipid can be accumulated in the cells. The major is triglyceride, cholesterol ester, phospholipids. Phospholipid basically are the components of the myelin fibers. Myelin fibers are the product when there is a cell injury. So the end product of this, after the cell goes into apoptosis or necrosis, the necrotic cell, most commonly in the necrotic cells, the end product will be the myelin figures. They are small vacuoles like structure, and basically जब भी हमारे पास जो है necrosis होगी, and after the necrosis there will be myelin figure. In addition, abnormal complexes of lipid and carbohydrate accumulate in the lysosomal storage disease. Triglyceride and cholesterol accumulation we will discuss here. So basically steatosis, that is known as the fatty changes, and the liver, basically steatosis means that there is fatty changes होंगी, abnormal accumulation होगा ट्राइग्लिसराइड का जो और ऑर्गन जो हमारे पास पैरेन्काइमा है सेल्स में वहाँ पे. So basically this is the steatosis. As you can see the photomicrograph picture of steatosis. The fatty liver, high power detail of fatty changes of the liver. In most cells, the well preserved nucleus is squeezed into displaced rim of the cytoplasm about the fat vacuoles. Here you can see this is the fat vacuoles, empty fat vacuoles. ठीक है. Sometimes they also giving the appearance of signet ring appearance. So basically what happened, the fatty changes often seen in liver में, ठीक है, बिकॉज इट्स अ मेजर ऑर्गन इन्वॉल्व ऑब्वियसली एज यू ऑलरेडी नो. और मैं इसमें एक लेक्चर भी बनाऊंगी जिसमें आई विल ब्रीफली एक्सप्लेन हाउ द फैट मेटाबॉलिज्म टेक प्लेस इन लिवर. It can also happen in the heart, muscles and kidney. The cause of steatosis basically includes toxin, protein malnutrition, diabetes mellitus, obesity, anoxia. इन डेवलप नेशंस द मोस्ट कॉमन कॉज ऑफ सिग्निफिकेंस, अगर हम पाकिस्तान की अगर बात करते हैं, हमारे यहाँ जो माल न्यूरिश, वी हैव माल न्यूरिश्ड ऑल्सो, बट अगर हम बात करते हैं विद द ईटिंग ऑफ सो मच फैटी फूड, so the fatty food leads to the fatty changes in the liver and it will leads to the steatosis, as well as अगर हम वेस्टर्न कंट्रीज़ की बात करते हैं with the abuse of alcohol, so it will leads to the fatty changes in the liver. And it is divided into two forms. With usage of alcohol, if it's happened, then it is known as alcohol abuse, or if it's not happened, it's happened purely due to fatty or diabetes or obesity, then it is known as non-alcoholic fatty liver. ठीक है. फैटी लिवर जो है वो आई विल एक्सप्लेन इट डिटेल. अभी सिर्फ हम एज एन होल इंट्रासेलुलर अक्यूमुलेशन बता रहे हैं. नाउ कम्स टू दी अनदर cholesterol and cholesterol ester that I will be explaining in my next video.